Hey everybody, welcome back to Cups of Joe's PT. I'm Joe Lavaca.
And I'm Joe Gambino.
So in today's episode, we want to bring you another very highly spoken about topic, another one that we debate and talk about, just as I'm sure you guys do, and that's going to be foam rolling or self-myofascial release techniques. And these are things that me and Joe use every day with patients and clients, and we see everyone doing them every day in the gym. And I think the biggest problem that I have with it is people just rolling to roll and telling me that it's releasing things or breaking down all these adhesions and whatever other kind of scenario that they want to present to me, but more so doing it without an intent or a purpose. One of the things that we were talking about is, hey, if you know you have a dorsiflexion restriction, cool. Let's foam roll the anterior tip. Let's foam roll the gastroc. Let's get a little cross ball into the plantar flexors. Let's do anything that you want to do to help open up that range of motion. But so many people are just rolling to roll, and then if they think that they've come across a place in pain, then that just needs to be keep rolling out and rolling out and rolling out. And I don't know if there's a really good outcome measure for pain and self-myofascial release. Or, I mean, have you found that?
I don't know if there really is, but one thing I can tell you is that if you're rolling and rolling and rolling and 4 weeks later you're still rolling and your pain is still there, well, obviously we need to try something else.
Definitely.
So like Joe was saying, since I've been training, I even spent some time, like 30 minutes before I work out, foam rolling. And I I felt good, so why am I still foam rolling? So it becomes a time and place where we need to know when and why we're foam rolling. And then also when we're starting to feel better, because we have opened up those tissues, we need to move on to other things that are continue to better our movement rather than just continuing to foam roll and just do the same old things.
Exactly. So as far as another thing that kind of gets me going, especially when I hear patients come back and tell me they've been foam rolling for 20 or 30 minutes, or in some case this week, a patient told me that she spends about an hour foam rolling. That's just way too much. That's way too much. And again, if we want to talk about intent, that person's not getting enough of a guide or an explanation on what to do. One of the things that we talk about at our rock tape courses is what kind of skin receptor do you want to target? Well, if we're going after tone, that might be a little bit more of a Pacinian corpuscle that responds better to deep pressure. And some of our fascial technique research will explain that about 2 minutes of continuous input into this area is really what the tissue takes to respond or adapt to that stress. You can go longer for sure, but between 2 or 3 minutes seems to be that nice happy cutoff point where you might not be getting excrementally better with 10 more minutes or 15 more minutes or 20 more minutes, especially if you have a good test retest. If you want to just go after an activation or a quick warm-up, I usually recommend 10 or 15 quick passes over an area. Because one of the common things with massage therapists and chiros and PTs and you name it, if you find a weak muscle, what do? Rub it and put pressure on it. If you find a tight muscle, what do? Rub it, put pressure on it, okay? So if you're just trying to stimulate awareness into an area, get some blood flow going to that area, even though that might be a little bit debatable as well, you don't need these prolonged exposures, okay? What do you like to do after foam rolling? I mean, is there a test retest thing that you do with your clients or the pattern that you typically follow?
Well, after I foam roll, you check out to see if your pain symptoms, so whatever may have caused pain before, you can try to recreate it and see if it goes away. If that does go away, then that's a good thing. But the next thing you have to do is try to make these patterns stick. So all right, so you had some temporary relief, what do you do then? And then that would be before going into your workout, doing something active or some movement patterns in order to kind of grease the groove, so to say. So if you wanted to squat or overhead squat during your workout, well, after you foam roll the areas that needed foam rolling, then you would go maybe do some sort of thoracic rotation drill or some hip flex opener drills where you're just stretching the hip flexors. Even putting that into just a bodyweight squat where maybe pulling yourself into a squat, getting some sort of hamstring stretch in there and moving on. And once you've kind of activated and moved those into those patterns, then going in and doing your workout should set you up to feeling better, moving better, and have potentially better technique.
And having both taken FMS, from what I remember from the course, and you've taken it a little bit more recently than I have, they kind of talk about foam rolling as anything for lower extremity is like belt down is fair game, or neck down is fair game for your upper quarter. The good news is, for most people, you have 2 of everything. So if you have a spot that feels maybe a little bit tighter on your right side, compare it to the left.
Mm-hmm.
If there is an asymmetrical feeling there, meaning your right side, you have a come to Jesus moment, and you're seeing him and he's touching you and he's reaching your hand out, okay? And on the left side, you just kind of blow through, as was the case with me several months ago, then maybe spend a little bit more time on that right side, because that's the side that's kind of calling out for your attention, okay? But definitely don't just kind of keep rolling to roll. You're wasting your time. And as Joe pointed out before, if you're not getting that tissue adaptation, especially after a few weeks, you need to go somewhere else. Probably stability, probably motor control.
All right, well, I think that's all we have for today. You want to do your little saying?
Sure. First of all, before we sign off,
Oh, yes.
we love Toby's coffee. I mean, just fantastic. If you're in Union Square, this is the place to go. But until then, think more, drink more. Thanks for stopping by this week. We'll catch you next week.
Cheers.